as per the advisory of National Medical Commission on National Plan for Dog-Mediated Rabies Elimination by 2030, which was jointly launched by the Ministry of Health and Family Welfare and Ministry of Fisheries and Animal Husbandry and Dairying on 28th of September 2025. I'm going to tell few things about the rabies. We have to see what is rabies. The rabies is a viral disease that affects the central nervous system, that's brain and spinal cord. Once the symptoms begins, the rabies almost the fatal. We are living with this rabies, where the many number of cases of rabies are there in the world. Then how it spreads? Usually the dog bites are main source in Asia and African countries. But in US, if you see the animals like bats, raccoons, and foxes, skunks are the main common reservoirs. And primarily, this virus will spread through saliva of infected animal via bites, scratches, or sometimes when saliva contacts the mucous membranes of the oral cavity and also the conjunctiva. And then what is the incubation period? That means after enter into the body, how long it will take to manifest in the form of clinical disease. Incubation period can vary from weeks to months, depending on type of bite and site of bite, and also the severity of exposure and the vaccination status of the individual. And during this phase, there are usually no obvious symptoms. But when the symptoms starts, and what are the symptoms? The symptoms in the early stage of disease, that's the early stage of the rabies, there will be fever, headache, generalized weakness and discomfort like tingling and itching sensation along with pain at the site of the bite. And of course, it manifests in two forms. One is furious rabies, and where the people may experience the confusion, agitation, hallucinations, loss of sleepiness, that's sleeplessness, and presence of hydrophobia, that means fear of water. Whenever they see the water, they fear like a choking effect. And another one is paralytic rabies, where the agitation, aggression will be there. Of course, hydrophobia also will be there. Apart from that, the patient may experience the weakness and the paralysis. Then, next question is how to prevent this. Pet owners have to vaccinate their dogs, cats, and never play with stray dogs. And unvaccinated dogs also have to be avoided. And pre-exposure vaccine is best, that is before exposure to the dog bites. If you are living in the dog endemic area where the many dogs are present, a rabies endemic area, so better to have the pre-exposure. So before getting the bite from the dogs, we have to go for vaccination. And how to take care about the dog bites and scratches? That's the next question. Use lot of soap and water and to wash that bite area or licked area by applying a lot of pressure on the bite and to remove all the viruses from the bite site. And next important thing is avoid suturing of the wound, and vaccination has to be done within 24 hours to the exposed individuals. Otherwise, efficacy will be reduced. The vaccine efficacy will be reduced. And discuss with your doctor for further vaccination and vaccination schedule. And the facts regarding this rabies is finally, unfortunately, we are living in the capital of rabies, of course. And mortality is 100%. There is no cure for it, and vaccination saves the lives. And education is crucial to people to recognize the risk and also I have to act fast. That's the reason why we are celebrating 28th September 2025 as Rabies Elimination Day. And I request all of you to create awareness among these rabies in the public or in the community. Thank you.